Welcome everyone for today's English session. As usual, we'll begin with a silent prayer. Thank you and welcome once again. Today is our 1925th day of continuous webinar. Today's our guest is Dr. RUCHI MEHTA. She is MD in Homeopathy and PhD in Homeopathy, and she's working as an assistant professor in the Department of Gynecology and Obstetrics and in Jaipur University of Homeopathy. Today, she's going to speak about the Bach flower remedies. Dr. RUCHI MEHTA, you're welcome. I already made you as a co-host. Dr. RUCHI MEHTA. Okay, doctor, you're welcome. You can talk now. Please unmute yourself.
Hello, good evening. This is
Good evening.
Dr. RUCHI MEHTA. I'll be talking about Bach flower remedies. So shall we start?
Yes, of course.
So ma'am, we will be talking about Bach flower. I know many people have been working on Bach flowers. These are my few recent experiments or recent trials with Bach flower. And I do heartily believe that always a homeopath fails. Never homeopathy fails. But because of my few failures, maybe my lack of knowledge, I started using Bach flower for my few cases, and those were purely psychosomatic, which gave me immense good results. So I felt like sharing with you all. So a mind is a mirror which reflects the physical state of a person. I hope everybody agrees to it. That mind is the basic mirror which reflects your inner physical state. That's why we say if you are happy, it reflects. If you're mentally happy, if you are gay, if you are in a good mood, reflects upon your physical appearance. Your face also glows with it. So then Dr. Bachelor says, finally, Dr. Edward Bach, who started the Bach flower remedy, says a final and complete healing will come within from the soul, which by his beneficence radiates harmony to the personality when allowed to do so. If you are happy, if you feel mentally happy, this is what Edward Bach started his studies with. As we all know, I want to minimize this screen, yes. Is a form of alternative medicine consisting of 38 different solutions, maybe from highly diluted extracts from wild plants and flowers, which corresponds to a specific emotional or mental states. They are intended to support emotional well-being and not based upon conventional medicinal evidences, as we have in homeopathy. So these are basically remedies made by flowers. They are basically for emotional imbalances and psychosomatic conditions. And the remedy was developed by Dr. Edward Bach. He is the same Edward Bach who with Dr. Morgan devised the what we say that Morgan and Bach divide the dysenteries and all that, the remedies which were drawn with Dr. Morgan. But Dr. Edward Bach by himself, he was a pathologist and microbiologist and bacteriologist, and he was a homeopath also. So he was, while traveling, find out that when the flowers fell down in the spring water, hello? Ma'am, am I not audible? Ma'am,
You are audible. You are audible, but your video is switched off. Have you?
Ma'am, my PPT is visible. No, I want to show the PPT basically.
Okay then. Okay, continue. Now you are audible and PPT is also visible. Okay.
Okay, ma'am. So he basically was traveling. He found out that the flowers have got their energy, and when were transmitted inside the spring water, they were having the healing effects upon the body, especially upon the negative emotional states. And this was a very good healing property from which he started the philosophy of Bach flower. According to Dr. Bach's philosophy, the basic cause of all the troubles is obstruction with a man allows to be placed in his chosen way of life or the chosen life of some other person. Means the basic cause of all the trouble is when you are obstructing your emotions, you are not able to let out your emotions, your positive, or you are having a pile of negative emotions. When you are not letting them out, it provides the problem, starts the problem, it triggers the problem. Whenever a person ignores the guidance provided by the inner voice, if my inner voice says I want to do this, this is right, this is correct, but out of any ordeal or because of any social pressure, social behavior, I suppress my inner voice and acts against my conscious. My conscious was saying, don't do this, this is not good, you are not doing right. But anyhow, because of social pressure or something, I started doing that, which was against my will. This will disturb my mental peace and will result in some emotional imbalances. The physical ailments as such has no meaning. It is an expression of mental disturbances. He says, "Oh, all that comes on the physical plane is because of your mental." We also believe that the psychosomatic complaints are always there. But he says, as soon as your mental things improves, the physical troubles also disappear. Now, this was the basic philosophy. How to use these remedies, it is also, there are different methods. The remedies are sold in liquid form in a dropper, while you can use by mixing 2 drops or 3 drops in a water, and you can mix up to 7 remedies while treating a patient with a batch flower. But what I feel is, and as per the guidance also, when I want to give more than 3 remedies or 4 remedies, I divide into 2 groups. 2 in 1. If I want to give 5 remedies to a person or 6 remedies, then I divide into 2 batches. For a week, I give 3 remedies. Then for other week, I give 3 remedies or 2, 3, whichever I feel like. Whichever is more indicated. In a difference of 1 week. 1 week I give 1 medicine, then other week I give. This is the way they say they use. They are non-toxic and considered safe. So because they have got no effect, they can be used with water, and even brandy can be used as a preservative. So key remedies and their indications, many of might be using the bachelor remedies and might be knowing. But to summarize this, we go with argimony. This is mental torture behind a cheerful face. I'll present a case in which argimony was being given, and it gave me a very good result. When a person is having a torturous past, but he is not able to open up or has something in his mind, he's undergoing many psychological trauma, maybe suppressions, maybe lack of expression, but he's cheerful. For the outer world, he's very cheerful person. He's the boldest of all the person. This is where argimony comes. When we come to aspen, aspen is like fear of things, apprehension, various kind of apprehension. I might face something. I don't know what. If out of my house happened to me, this is what aspen calls for. When we come to beach, it is intolerance, want order, discipline. He is sometimes inhuman also when it walks to the cause, keeping things orderly. Then we have century, weakness of will to influence by others, the patient to reason by. Sorry, was the flaw from my side? I don't know what happened, but there was some problem with it. Let's start.
Okay, it's okay, doctor. It will happen sometimes.
But I don't know how it happened. But anyway, sorry for the disturbances. Let's continue. I hope we have completed with argimony and aspen. Beach is intolerance and want order. He is sometimes very inhumane also. When it comes to century, weakness of will to influence by other. This is somewhat like calcarea, silesia, want to be magnetized kind of personalities we have with them. When it comes to citrato, this is self-disgust, those who doubt their own judgment, whether I have done something right, is my decisions correct or not. I have given this remedy also to a person in the same case, where the patient was so doubtful that he even doubted that did I had taken a right decision of getting married, Was my decision right to have kid? So this is where the Cerato stands for. Then it comes to cherry plum. This is fear of losing control. Chestnut bud is fear of learning from past mistake, refuses to learn. Failure to learn from the past mistakes, and he refuses to learn. What I did was correct. Then when it comes to chicory, possessiveness and self-love. This is also I've used in one of my cases. Clematis is indifference, dreaminess, absent-minded. He's having, it is somewhat like sepia, having indifference. He's lost in absorbed, he's lost in his own world. When it comes to crabapple, this is where syphilinum, we can have a comparison with syphilinum, like feeling of uncleanliness or having poor body image, keeps on washing hands, keeps on washing his feet. Such kind of symptoms to appear. When we come to elm, this is occasional feeling of inadequacy, exhaustion. He's over exhausted. Gentian, discouragement after setback of pessimism. Gross is hopelessness. Heather is self-centeredness or self-concern. The patient is only concerned about him or herself. Holy is hatred, envy, jealousy, and need for love. When it comes to honeysuckle, this is dwelling too much in the memories of the past. Patient is not able to come out of his past. He's still revolving around his past. When we come with hornbeam, mental and physical tiredness, the patient is very tired, does not want to do something or not even want to listen to you, because he thinks if you are going to give me an idea, I have to go with a mental workout and then do it. Then impatience, where the patient is impatient, irritable, agitated. Larch is for lack of confidence. Minimus is fear of known things like public speaking, like lycopodium. बोलने में डर लगता है. Fear of speaking in public places. Illnesses. I might have some big disease, fear of great disease or impending disease like calcaria, where mimulus can be used. Mustard can be used when we think of deep gloom or depression of no known reason. Oak is despondency, despair. Olive is complete exhaustion. Pine, same self-blameless, self-reproaches, feeling of self-guilt. Oh, what have I done? Like have Aurum, we have Aurum with us, who says, I have done something crime, unpardonable. Whatever happens around me is because of me. Everything that happens is, like Aurum says, same is with Pine. He also says, whatever is happening is because I have done something, or it is my fault. Red chestnut is fear of anxiety for others, obsessed by cars and concern for others. Rock rose is terror, panic, and extreme fright. Rock water is for self-repression and self-denial. I didn't do this. I was never in the such thought. This is what rock water thinks of. Scleranthus, uncertainty, indecision, and hesitancy. Star of Bethlehem is shock, loss, or after some bad effect of some trauma, especially for the females who have just delivered. Delivery complaints after delivery patient is unable to or is having a postpartum depression. She is a patient of Star of Bethlehem. Sweet chestnut, fear and anxiety for others, utter dejection is there. Then we have verbian, strain, tension, overexhaustion. Wine is for domination, ambition, usually for good lawyers. He's over ambitious. He wants to dominate. He wants to rule the courtroom. And walnut is a very beautiful remedy, and I give it many times for teething troubles for the kids that come to us, because it is for the adjustment of anything. A girl got married, went to in-laws. Walnut should be given to her because she has to adjust into another environment. Then at menopause, at puberty, after delivery, because adjustments are there. A couple is shifted from a joint family to a nuclear family, or from a nuclear family to a joint family. Then also walnut is indicated. Then water violet, that is for pride, proud, reserved. White chestnut is unwanted thoughts, mental augmentation, and inability to concentrate. They are very poor in concentration. Wild oats is for uncertainty, dissatisfaction, despondencies. Then wild rose is for resignation, apathy, ambition. Willow is for resentments and bitterness. And then we have rescue remedies. That is a combination of 5 essence remedies. Oh, everybody knows. Star of Bethlehem, rock rose, cherry plum, impatience. That is for acute condition. If a patient comes to your clinic, faint suddenly, you don't know what is the reason. Rescue remedy can help the person. If suddenly a person while going on the road has some accident, incident, sudden respiratory failure, sudden panic attack, you can think of rescue remedy. This was a brief of 38 remedies with primary indications. We go to other part is grouping of the remedy on basis of emotions. This is what I feel that we should think of. Okay, when we are thinking of an emotion that is related with fear, fearfulness, then rock rose is there, mimulus is there, cherry plum is there, aspen is there, and red chestnut. There are very small differences between all of them. Like aspen is for unknown fear. So there is very keynote or small differences among them. Then uncertainty, when we think of an uncertain thing that might appear is ceratro, cerethus, gentian, gross, hornbeam, and wild oat. Then a lack of interest in the world around you, around anybody is clematis, honeysuckle, wild rose, mustard, olive, white chestnut, and chestnut bud. When the person is quite lonely, then water violet, impatience, and hither is there, and oversensitive to others, then argimony, because he doesn't want to show his negative or sad side. That means he makes his face bold. That is very sensitive to others. The others should not observe him. That is argimony. Century, walnut, does not want to show the changes in the environment. Then holy, general discontent or in despair. That is larch, pine, elm, sweet chestnut, willow, oak, star of Bethlehem, and crabapple. And over concern for others is cherry, vervain, beech, rock, water. This was a very brief. Many of you might be knowing all these about all these. I would like to share a case of mine which came to my clinic, and this was a case referred from my friend, a very dear friend of mine. And he was basically, this was his patient, he was his patient, and he shifted his clinic or job from this part to another part of the country, and he referred the patient to me. He was already has sometimes taken homeopathy medicine. He knows that homeopathy is a for a psychosomatic origin. He was relieved also, but when he came to me after a year or so, and he was not on any treatment, not on any homeopathic, not on any treatment. And he was a case of, this was a very good case, and he was a diagnosed case of OCD, obsessive compulsive disorder. In this case, the basic thing was, this was a case who was having a genetics for OCD. His grandfather, the male said, my grandfather also had some OCD kind of thing. Basically, his grandfather was in habit of picking up things like kleptomania. But this was an obsessive disorder. He knows this was wrong. He said to many people, this is what I'm doing is wrong. But still he had an compulsive disorder of picking up of the things. Father had a very compulsive disorder of distrust. He never believed anyone. And he knows that what I am saying is wrong. This, my wife is a true person, is a loyal person, but he was having a habit of not trusting anybody. So he was even pointing fingers on his own sons, daughters, everybody. So this was something. And then he had an obsessive compulsive disorder. Now, during our last visits, he was saying my daughter also developed a compulsive habit of rubbing her legs over one another. I said, okay, fine, we'll talk about her also. This is a male who is 41 years of age, in nationality is Indian. He's a teacher, non-vegetarian by diet, married, and he's a highly educated person as he has done his triple post-graduation. He comes from an urban background and was a diagnosed case of OCD by an allopathic physician. Now we come to the history. Complaining of excessive curiosity. He was a very curious person. To his curiosity, he used to read a line 10 times, 12 times, 15 times in order to get something from in between. He said, Madam, I keep on reading lines. I keep on reading lines. I feel as if there is something written in between and I am curious to know about it. This was his side of curiosity. He kept on repeating things with a poor concentration since childhood. He was eldest among six siblings. The father was always suspicious about his mother. As I told you, this was a case where there is a family history of OCD is running, obsessive disorder is running. The father was suspicious about his mother. He also had psychiatric disorder, and this man was always talking about his past. My father used to do this. Like the past was, he said, my past is always clinging with me, is always haunting me, is always walking with me till the date. And he keeps on thinking about his past, what his father used to do. I don't want to do like my father, like my grandfather did. I don't want to do like that. Like I had my sibling relationship. There were some differences. I don't want to repeat those. So whenever he was talking, he's talking about much about his past and less about his present condition. He had a habit of keeping the things to himself and that does not share his problem to others. Because he was eldest among the six siblings, the father had an habit of suspicion, keep having suspicious activity or thinking about something is negative about everybody. So he was like a bold face to the family. He was like protecting all his five siblings. And he said, I am the eldest of the family and I have to protect my brothers and sisters. So I cannot show them, let them notice that my weakness, or I'll be mocked if I'll be known. My younger brother will say, oh, you don't know anything, you are just keeping your face. So he was having this attitude. He was average in studies and keep on repeating lines. He was not satisfied by what he was studying. He said, Madam, I know there is something in between. I am curious to study the things that are in between. So I am not satisfied. And this not satisfied attitude will be reflected in one or other also part of his understanding. He started having sexual desires very early, but keep suppressing them till the age of 27 when he was married. And his relationship with his spouse was not good. He had many conflicts with her, and as they have disharmonies, he said, Madam, I feel as if I have lost all the battles of my life. I am not fit. I have lost everything. Madam, I am so and I am a kind of person who tries to protect everybody, but I have lost everything. So teacher, but he cannot speak in a crowd many a times due to some social activities or some sports. I fear, I fear that I might speak wrong words in presence of other senior students. I might be mocked or I might do something wrong. So he keeps on repeating same words. Or I might keep repeating same words. Shut up or sit with the finger on your lips. So he said, I am really, I cannot face and I feel depressed about it. He even feel depressed about his own judgment. He said, am I at the right place? It is my right decision to go for homeopathic treatment? So in this, you can understand two things. It is depression as well as doubting his own judgments. Now, forgetfulness was there because he was so concentrated, so curious about things, and left sciatica since few days was his basically primary complaint when he visited me. So I hope you can understand his mental condition, that he is a person who has got compulsive disorders. He has got a family history with this. His family history moves around with him and he feels too much depressed about his own things. And at the last, he feels, I have lost all the battles of my life. I want to become a government doctor or teacher, but I'm not able to qualify the exam. Every exam I fight, I try to get the answer from the question which is written inside them by reading. There is something which is there. So he is very curious. In my clinic also, he was very curious. You will be giving me what medicine, which potencies. He's read about all these things. Which potency will you be using on me? Why this potency? He was very curious. He was, how did you go for a homeopathy? Why did you do a PhD in homeopathy? He asked me n number of questions. And though the patient was interesting, because I am a doctor, I feel like more you talk to me, the more I come to know about you. But still, see, appetite, when I take the patient profile as a whole, appetite was twice and was satisfied after food. Thirst was decreased. Desire for sweets was very high. Craving, rather desire, say he was craving for sweets. Aversion not specific. Urine was he was having mild burning off and on, because he said I'll drink less amount of water. So he knew everything. And so I was having because I have googled it, why I am burning. I am having burning in urination. Drink less amount of water. So I know, doctor, I have this. He by himself answered that my stool are constipated hard, because I don't drink ample amount of water, so I'm not satisfied with my stool. I feel like, okay, I'll go again. Thermal reaction was hot. Bathing habit was regular with the water according to the climate. Perspiration was non-staining. He has a bad addiction for tea. Then sleep decreased for 2 to 3 hours and overactive. He said, madam, even if I am sleeping, my brain is working somewhere. It is having something. It is having some thought. It is having something that is triggering me. I feel like I should get up and do something. And dreams are of daily activities, as if I am teaching in a class. I am doing so great in the class. I am so enthusiastic. I am teaching something new. Vaccinations were all. Now we come to the sexual history. As we have already studied, and he has told me in the mentals also, that sexual desires were excess. To the point, premature ejaculation. He was so excited, overexcited by himself, that he was having premature ejaculation. And as if he was too enthusiastic and overexcited. He said that even while watching movies, he used to have discharges, and his wife was mocking. See, you don't do anything, you don't perform anything very good. You are so. But he said, madam, it is my fault that I am so enthusiastic, so excited. My desires are so excess that as soon as I try to complete the act, I have a premature, before entering also I have premature ejaculations, and that results in mocking of the wife. And this is the basic result why they are, husband and wife are fighting over the things, because he was having disharmonious relationship. This was the basic reason what I felt was of his disharmony. And he feel disgusted. He feel, oh god, I am good for nothing. I have lost everything in my life. Not even my wife is satisfied. These were all his expression when he came to me many times. Then family history: father had OCD and is still alive. Mother is healthy and alive. Grandparent, again grandfather, paternal grandfather had OCD. Maternal grandparents were dead, and as per the age related complaints, sibling, brother died of blood cancer. This is what I got in history. Then the past history with outcome: medical history it was nothing. Surgical was operated for sinuses and cholecystectomy done many years back. So I tried to crack this case with homeopathy. So I tried to have these rubrics: mind absorbed, mind anxiety, attempting things; mind anxiety, conscious, forgetful with; mind confident, want of self-confidence; mind delirium, erotic; mind erotism; mind concentration difficult; mind overacting; and sexual desire increase. With the repertorial totality, I gave phosphorus, veratrum, cola, lachesis. He was not a phosphorus. He was not a jovial person. He was very talkative, very, very, very talkative. His sleeps were disturbed. So I thought lachesis to be the first prescription. This is what, because I'm already telling that homeopathy never fails. I, as a homeopath, might have failed in this condition. So I started the complains with lacasis 1M 1 dose. He said, Madam, when you gave me the medicine for 2 days, I was good. Then I was again having the same problems, like my sleep was also disturbed. I was unable to concentrate. My mind was acting very high. So I think lacasis was helping him. So I prescribed 3 doses alternate days with rubrum for 7 days. Now he came to me saying, Madam, I have started having good sleep, but feel a two bit concentrated also. So again, same prescription was repeated, like lacasis 1 and 3 doses every alternate day with rubrum for 7 days. But I don't know what happened. But again, the anxiety increased, lack of concentration, continuous talking about the past. He came with all the stories which he has talked with me again. Some new stories were added to it, and he was so anxious, restless also. He wanted to give me many symptoms. But the thing was, which made me again think of lacasis, was he was talkative and he was jumping from things to things. He was talking about his anxiety. He was talking something happened in the school. Then he again went to his past, saying something happened. Some story was there from the past. So I thought this is more over lacasis, maybe because my potency is less. So I prescribed lacasis 10 m 1 dose followed by rubrum for 15 days because he was going some outstation. Now, when he came back after 15 days, he was having again multiple complaints. Now, the complaints were on a physical plane also: hyper anxiety, acidity, over anxiety, awful, and full of uncertainty. So, I thought lacasis 10 m is a higher potency which I have prescribed. So, I gave her Saclac rubrum 1 dose, Sacram 200 1 dose, rubrum 30 for 15 days, thinking that the higher potency was giving a aggravation which will settle down. So we continued the same treatment for approximately 1 month or so. But he came on in 1st November 24. He came to me saying, Madam, I am a big failure. He had stories from the past, many complaints, patient, and he was calm, short, as if nothing was going on. So I said, okay, you take this medicine for 3 days, and then I'll think. At this point, I started thinking of batch flower because it was introduced to me by my mentor, and she said batch flower is when there is a clear cut psychosomatic condition. So I thought this is something. If I'll try some other medicine, he might be ameliorated for 2-3 days, then again come with a new story. So let's try batch flower. This is the point where I started thinking of batch flower for this case, because being a homeopathic instinct, I thought of having a homeopathic medicine to be my first prescription. So when I was restudying his case, I found out some symptoms to be very important, which I found was the keynote of this whole story. First was excessive curiosity. Anxiety ran in all his activities. In all the visit he made, he kept past haunting him. In every visit he made, past events were part of his conversation. He was never away from his past. I had something in my past. This was my past. My father did this. My brother did this. I am there for them. This, so he was always talking. So I said, this is a very important part of his life. Then he was very over enthusiastic and wanted to be more in learning, reading, or even sex. Matlab, he wanted to do something different, something enthusiastic and over excitement. So I took this as a keynote. He feels depressed also, and he said it was a complete failure because of his over enthusiasm. He used to fail. So when he used to fail, he used to doubt his judgment. Did I do a right thing by marrying this lady? Did a right job doing? I'm doing a right job or not? Was my decision right to have kids? Should I do this? Because he was doubting about his judgment, and this was a very peculiar thing. In this whole story, out of 6, I felt few things were very peculiar. His curiosity was very peculiar. His past was like clinging to him. Every line, 2 or 3 past was there. Then overexcitement was like something. And when he was failing from that, because of his failure from overexcitement, he was depressed. Then he was doubting his judgment. And Although everything was happening there with his friends who accompanied him once, he said he's a very bold person. He is a very strong, rock solid, strong personality is there. Next visit, when I asked him, what is this? So he said, so what, madam? I have to keep my face in front of everybody. I cannot show them my failures. I cannot show them my negative side. Otherwise, they will mock me. So these were few key important symptoms which I felt was a part of his personality. So when I went for the studying and remedy selection, I found out that excessive curiosity, anxiety ran all his activities. This was Vervian. This was the medicine. In all the visits he made, past was there, like honeysuckle. Like honey, it was stuck to him. Oh, very over enthusiastic. Vervian was again there, never satisfied and wanted to be more in learning, like a peculiar soric person. He wants to learn many things, want to know everything. And wild note covered this symptom. Feel depressed and always said it was a complete failure. This was a clear cut keynote of Wild Rose. And his doubtment about his judgment, jobs, this was Ciretro. And but in front of everybody, he gave a brave face. This was R.G. Manita. Then we started with homeopathy. So where anxiety, self-doubt, and repetitive action, Wild Rose 30 BD. BD means 1, 2, 3. Every 2 hours or 3 hours, you have to take medicine. Take 1, then take 2, then take 3, then again 1, 2, 3. And this was the way of prescribing for 7 days. Feeling better, but again the pass was stuck to him. Then we gave honeysuckle, Ciretro, and again the same method, 1, 2, 3. Then you have to go with, after finish 1, then 3 hours 2, 2, then 3 hours 3. Then again after 3 hours 1, then 2 and 3. Every 3 hours you have to take medicine in 1, 2, 3, 1, 2, 3 method. Then when he came after 7 days, he said to be, though he is feeling the same, but I felt he was a bit relaxed in talking, less anxious in talking. He seemed more composed. So I tried ki we have to go with this remedy. So this was a well suited group which I felt, and I started repeated again then I don't know why, maybe because of some reason or because of the physical complaint, the suppression was there, something. He came to us complaining of small eruption all over her body with itching. At this moment, I thought of prescribing sulfur because I felt that it was a suppression which came out when he was a kid. He had such eruptions. He said this was something which I had from my childhood, but at that time it was being treated. Now again I am having the same complaint. So at this point I thought I should give sulfur, but somehow I said I shouldn't disturb the case going with batch flowers. So I somehow restrained myself and again went with the honeysuckle, Ciretro and Virven. Few of his symptoms like anxious, recalling the past bad events of with father, and highly dissatisfied were aggravated, and he had a discussion, as he had a discussion with his father for his sibling. Again, RG Mani's basic fundamental picture, that bold face against depressed self with his father, and he came to me the same day because of his some siblings relationship, and his father was again doubting his siblings and he was protecting them. So out of that this thing happened. Again, same set was repeated, Wild Rose, Wild Oat, and RG Money. But this time when he visited me last December, he was very much calm, composed, more confident. And this was more confidence was the part for the first time I was seeing in his treatment. He was never so confident ever. Then we didn't talk about skin eruptions, but skin eruptions cleared and feeling of sim also were control. We gave the same medicine. Read the whole chapter because previously I was used to read a line, then keep on repeating the line, keep repeating. So I felt this was going good. But I don't know why. He visited me. He had a sudden rise of fever for 2 days. I prescribed ferrum pause as per our part that for fever, again, we should give help him with something. But this was high fever. It was 102 or something. Then he, after 7 days, he visited me saying, Madam, I didn't take your medicine which you give me extra bigger pills. As I had fight with my wife, I threw the medicine. So I didn't took the medicine. I was only on your medicated ones. These medicines I am giving in medicated globules. I'm not giving in water combinations. Then the condition was under control. Same medicine was going on. Patients still visit me off and on with, but his condition is under control now. Prescribing is only on her presenting symptom, and I am practically very afraid of withdrawing any medicine because he's having a very strong family history. He's not a regular visitor now because I feel he's feeling better, so he's not coming. He comes with sometimes some with some problem or with other problem. His problem is totally emotional. He never comes with physical. Physical is a resultant of either some acute infection or some other reasons. So I feel this is all his conditions are now under control, but I don't have courage to withdraw the medication because he's not on these group now. He comes to us coming with some other complaints. So sometimes I prescribe argimony, sometimes wild rose, sometimes walnut, but he's not having those problems and his condition is still under control. This was a case which I wanted to share with you. Do I have time to share one more?
Yes, doctor, you have 8 more minutes.
Okay, I'll do it very fast. I hope this case was clear to everybody. I'll go with a second case very fast. This is a female and she's 42 years, vegetarian, will and he came to me primary with anorectal complaints. There was some anorectal tear which was diagnosed. He said, then I have a dust allergy for 4-5 years, sneezing. This was a clinical picture of dust allergy. He feels stitching pain in the anus, splinter-like, and pricking in anus, burning in micturition since few days. His appetite does not feel like eating, hardly eat one meal per day. Thirst also decreased, and desire for sweet were high. Aversion, nothing specific. Urine was having burning. Stool offensive, not well formed. Thermal reaction. She was not able to decide. She said she was very confused. I feel hot also, I feel cold also. Sometimes I am not happy with summer, sometimes I'm not very happy with. She is basically a confused personality. So regular bathing is regular, addiction is 40, sleep decreased, and 2 to 3 hours since 5-6 days and non-refreshing, and dreams are not remembered. Sexually active, regular intercourse 2 to 3 times a week, painless, desire, moderation. She had only one child, which was full term normal vaginal delivery 20 years back. She is eldest among two siblings, had a juvenile childhood and average in study, got married early in 19 years. Mother-in-law was very cooperative. She was having good relationship with husband since few years after her father-in-law's death. Her mother-in-law chose to shift with her brother-in-law and left her. So she developed a compulsive disorder to wash hand again and again. On asking, she says she want to keep her family safe. Her basic concern was, and this was developed after COVID. She said, before COVID, I was absolutely normal. But after COVID, I developed a compulsive disorder of washing hands because I feel I should take care of my family. Weeping disposition, consolation is desire. She's very worried about her health. Every statement was concerning himself. She was so self centered that she was only concentrated about herself. She kept on thinking about his complaints, self centered, and feel depressed. This was the basic case. Family history was a sibling was having allergic dermatitis. Healthy parents were healthy. Her father recently developed a heart complaint. Few days back only, they were diagnosed with some heart problem. Mother is healthy and alive. Grandparents are both dead. Nothing's. See, with the patient with coming with us because of anorectal sphincter pain, acid nitric, as we all think. 7 days, after 7 days, amelioration, burning, micturition. So rubrum was being. Then recurrence. I took this case on batch flower because of recurrence. I was very fed up of his recurrence. Then again, acid nitrate. Then we said, okay, she said 10% is remaining. What we do is, when the prescription is very well suited, we raise the potency. So I gave acid nitrate 200 OD and 1 dose, that is, and then followed by rubrum. Amelioration, then recurrency. Constitutional was given because pulsatilla came out to be a constitutional remedy. But amelioration for few days, then again recurrency. Then what I did is I switched on to homeopathic medicine. Heather, red chestnut, and aspen was being given. Aspen because she was having a fear of unknown origin. She was not having. Heather was considered because she was self-centered. And I, this time, I added all three in a vial. And dilution thrice a day. You take the dilution because I knew she will do something problematic if I give her medicine in that way. But she was very impatient, hopeless of recovery, and wanted to want appreciation for all her loved ones. She said everybody should appreciate. My husband doesn't recognize my conditions. So impatient, chicory, and gross was given in the same way. Then again, better, she was better in her conditions than Hector and was repeated again. Amelioration. She had moreover amelioration with the same repetition. But she seems to be less concerned about the son since last few weeks. Otherwise, he was like, my son is self-centered, my son self-centered, my son doesn't give a 20. She wanted all her attention from her son and husband. A 20-year boy should revolve around her. This was her basic expectations. Then, moreover, she is more cheerful now. No more physical complaints. Everything is ameliorated, and as this in between she had status quo, so I asked for aspen 200 also. She was basically, I thought of aspen only. We withdrew medicine slowly. We withdrew medicine. See, here we were giving 3 medicine, 4 medicine, then we started withdrawing medicines. And last, he was having fear of unknown things, so aspen was given. Status quo was the condition, then we gave her to aspen 200. And then after she was ameliorated, the patient never visited by her complaints, but accompanied by many of her friends. So this was all about 2 cases which I thought need to be discussed on the platform with all of you. Thank you.
Thank you so much, Dr. Ruchi Mehta. It's a wonderful class. We lost some time in between. Otherwise, you started also late, no? The Hindi session finishes late. Even though it was
No
very...
problem. No problem.
Okay, thank you so much for your presentation. If anyone have any question, means you can ask. We have only 2 minutes. I think. Dr. Ram Parveshar.
Thank you, Anjali. And Namaskar, Manoj ji, everyone, Namaskar, or congratulations, Dr. Ruchi Mehta. Very nice, excellent session. Describe the batch flower remedy.
Thank you. Thanks a lot.
Batch flower remedy, very good remedy. And flower is a prevention of all diseases. Flower is a prevention of all diseases. A batch flower जो है very good remedy and rescue remedy. I am give the patient rescue remedy always emergency या acute case just like rubrum like जो है select homeopathic remedy and जो है mentally and physically anger etc जैसे wild rose depression of depression symptom. Wild rose is a very good remedy. and rescue remedies. Thank you, very, very thanks, Dr. Ruchi Mehta. Thank you.
Thank you, sir. Thanks a lot, sir.
Thank you so much, Dr. Ruchi Mehta, on behalf of
Thank you.
IFPH. Come again. Really wonderful cases with the batch flower remedies. Now we are moving to the Malayalam session. Thank you so much. Good night, everyone. See you the same time tomorrow. I'm inviting Dr. Manoj for moderating Malayalam session. Good night, everyone.